There, this is Ashley Dalzell with Benco Dental, and I'm here today with Spencer from Onpharma, and he's going to give us some information on Onset. So thanks for joining me today, Spencer.
Thanks for having me, Ashley. Really appreciate it.
Awesome. I'm excited. So let's just dive right in. What is Onset?
So for those that are not familiar with Onpharma, we have a system that buffers local anesthetic. Essentially, when you go out and you buy a local anesthetic cartridge, those cartridges of local anesthetic are highly acidic. It has a pH of about 3.5. So after giving an injection of local anesthetic that's not buffered, you are essentially relying on the human body to raise that pH from an acid, from a 3.5 pH up to 7.4, which is a neutral pH, before the patient can achieve pulpal anesthesia. So you're really relying on the human body to raise that up to physiological. Now, what buffering does is it removes the human body out of the equation. So no longer are you relying on the human body to raise that the pH up to 7.4 in order for a patient to get numb. You're doing it outside of the body, and you do that with the Onset mixing pen. What the Onset mixing pen does is it will raise the pH from an acid up to 7.4 in a matter of seconds. And I'll show you in a little bit on exactly how to use the product. But there are a few great benefits to buffering your local anesthetic. One is you're able to get your patients numb a lot quicker. So what we're finding is over 70% of your patients will have pulpal anesthesia in less than 2 minutes.
Oh, wow.
Another great benefit is it's a lot more comfortable for the patient. So no longer are you injecting the local anesthetic as an acid, which is the same pH as lemon juice.
Oh my goodness.
You're now injecting that local anesthetic at the same pH as water. So it's going to be a lot more comfortable for the patient.
Yeah, that's a huge difference. I mean, there's definitely a burn when you get your injection. So that makes sense if it's the pH of lemon juice.
It makes a big difference.
Wow. Okay, so is there a specific type of anesthetic that you can buffer, or are there different types?
Yeah, so about 98% of local anesthetics on the market are compatible with the Onset mixing pen. Offices could use lidocaine, articaine, prilocaine, mepivacaine. So again, as I mentioned, wow, it factors about 98% of the local anesthetics out there. So you could pretty much use whatever you're currently using with the Onset mixing pen.
Wow, that's great. I mean, it doesn't force them into using one thing, so that gives them a lot of options. I know that buffering was a topic before COVID, and there were people doing it in their office, but it seems to be a real hot topic now. Can you go into why?
Yeah, so that's a great question. So buffering, there are thousands of offices that are currently buffering their local anesthetic across the country. Before the pandemic, people were buffering for the reasons why I just mentioned, the patient comfort, the time savings, and so forth. Buffering local anesthetic is more important now than ever post COVID-19. And the reason why is because with the new guidelines that the CDC has come out with, they've clearly come out and have informed offices that are reopening that, and this is a direct quote, that whenever possible, dentists should remain with one patient until the dental care is complete. It goes on to add that dentists should don and doff PPE each time they enter or exit the operatory. So buffering will allow every single office to seat, treat, and complete. It's very simple and easy. So essentially what you're doing is you're able to seat the patient, administer the buffered anesthetic, you go to work right away, you complete the procedure, and you exit the operatory.
Gotcha.
So no longer, before COVID, offices would inject a patient, they would leave the room, they would bounce from operatory to operatory, they would go do hygiene, they would, pretty much be
Waste
killing
time.
time. They would be wasting time. And that's because they were waiting for the local anesthetic to marinate in the patient. So the great thing about buffering local anesthetic post COVID-19 is this will allow a doctor to seat the patient, treat the patient, complete, and then move on to the next patient versus having to wait 10 to 15 minutes, leave the room, bounce from room to room, and then come back. Now, there are three great benefits to seating, treating, and completing. One is reducing PPE consumption.
For sure.
So, as you know, PPE has been the number one, talked about topic in the dental industry in the last few months. And, there are obviously reasons behind that, but with seating, treating, and completing, offices are able to save 50% of their PPE consumption. And that's because offices will no longer have to leave the room,
Bounce.
remove their PPE, go do whatever they need to do, come back, reapply their PPE, and then treat the patient. So it's going to save PPE consumption. It's going to improve infection control, which is especially important in today's age because, cross-contamination. So your offices are able to reduce cross-contamination by 50%. And then also maintain patient volume. So by buffering, you're able to save 25 to 30% of your time. So it helps you, stagger your patients throughout the day. Maybe you're able to see more patients than you normally do,
right?
Or you're able to get out of there on time every day so you could attend your son's soccer practice or whatever it is. So a lot of great benefits to seating, treating, and completing.
For sure. And going back to the PPE, I know that just going through the numbers of some of my offices, most people have a mask, a shield, gloves, and a gown. And we're looking at anywhere between, if they have some reusable face shields and washable gowns, we're looking at maybe $1 a patient, but we could be looking at up to $10 a patient. So, the savings could be significant for them to change their routine a little bit. And it's not much different than what they're doing already for the change. Because what I've seen in a lot of the offices, they're scheduling their aerosol procedures back to back to back so that they're getting them all done maybe towards the end of the day or the beginning of the day, instead of having the back and forth of aerosol to non-aerosol procedures. So it fits right in, I guess is what I'm getting to.
Absolutely.
So how does the pen work?
So the Onset mixing pen, it's very simple to use. So as I mentioned earlier, you're taking whatever local anesthetic you're currently using, and you pop it right into the cartridge connector. And I'll discuss in a little bit kind of how the cartridge connector works. I don't know if you guys could all see that. So I'll zoom in just for a second. So you'll see that there are arrows on the pen. So you'll see a 1, 2, and 3. So again, it's very simple. All you do is just follow those arrows. So right now you're in the 1 position, you twist, you push, now you're in the 3 position. And what you're doing here is you're dialing this to 9. And you're dialing to 9 for any local anesthetic that you're currently using. It used to be 9 for some and 18 for others. We're making it easy for you. So you're dialing it to 9, which is injecting 0.09 milliliters of the sodium bicarbonate. So once you hit that button, you're releasing the sodium bicarbonate into the local anesthetic, okay? And whatever you put into the local anesthetic's got to come out. So you just reverse the steps. You take that cartridge of local. So some of that local anesthetic was stored in this cartridge connector, which is kind of like a sponge. So it just soaks up that excess solution. You get 20 uses. You get 20 injections for each cartridge connector and sodium bicarbonate carbule.
But everything happens within that pen, so
everything happens with the pen, and I'll do it in real time to show you how quick and easy it is to use it. So you pop that carbule of the local, dial this to 9, you push, you twist, you reverse the steps, you're good to
That
go.
was super fast.
Super fast. So in a matter of seconds, you're good to go. We're not changing your technique at all.
Mhm.
So nothing's changing there. All you're doing is you're buffering it. All of a sudden, we just took that pH from an acid up to 7.4. You pop this in the syringe. You give your local like you normally do.
Mhm.
And again, over 70% of your patients will have pulpal anesthesia in less than 2 minutes.
Wow. So could an assistant have this ready to go before the doctor walks in? Or is it something that needs to happen right before the injection?
Yeah, so that's a great question, Ashley. So we recommend that once you buffer local anesthetic, that you inject the local in the patient within 60 seconds. So it kind of reminds me of a bottle of soda, where after you unscrew it, it releases some pressure. So after you buffer local anesthetic, it gets up to that 7.4 mark. And after 60 seconds, that pH will start to drop a little bit. So it will start to become more and more of an acid the longer you wait. So we can't guarantee the results if you wait longer than 60 seconds. So we recommend you buffer and you go to work right away.
Cool. So kind of like how your Diet Coke tastes amazing on day one, not so great a little while after that.
Exactly.
Cool. So how much does this thing cost?
So our introductory package includes the pen itself. It includes, you could think of it as 4 20 packs of the cartridge connectors and the sodium bicarbonate, a reference guide, a manual that kind of talks a little bit more. It has some visuals and kind of shows you how to use the product, as well as a cleaning brush. So that goes for about $527 is our retail price.
Got it.
So once you buy the introductory package, all you're doing is just buying the refill packs of the sodium bicarbonate and the cartridge connectors. So it comes out to around $3 per injection.
Per injection. Okay, that makes sense. I know a lot of my offices are charging a PPE fee, and I don't know if you've come across that too. So if we factor in some of the PPE they're already using, so that round number that I was mentioning before could be between maybe $5 to $10, plus maybe $3 on top of that for the Onset. If they're charging $15 to $20, they're more than making up that cost.
Exactly. It kind of pays for itself. Plus, you got to factor in the time savings.
Definitely.
PPE savings. I mean, you're using 50% less PPE than you would if you than if you were not buffering. Right. So yeah, I mean, that's
certainly making them more efficient.
Absolutely.
Yeah, by being able to treat right there. So are there any special Benco deals?
There are.
All right.
So you're offering a 100% money back guarantee. So it really allows all your customers to buy the product, buy that introductory package for just over $500. And they have the opportunity to try the product on 80 patients, 80
wow.
injections, or for 120 days. And if for whatever reason they're not satisfied with it, we'll go ahead and take it back.
Wow.
No questions asked. So we're pretty confident in the product. We guarantee the results. We're confident that once an office once they start buffering their local anesthetic, they will not go back to their old ways. So it's really, really going to be a game changer, and it's going to add a lot to their practice.
Yeah, it's definitely a routine change, but they seem to be kind of used to that at this point, post-COVID. Lots of routine changes. So awesome. Well, thank you so much for joining me today. Will you go over some of your contact information, Spencer?
Yeah. So if any of you have more or want more information, please visit our website at www.onpharma.com. My cell phone number is 312-350-7937. So if any of you guys have any more questions on the product, I'm happy to answer any of them. So feel free to give me a call. But I really appreciate the time, Ashley.
Yeah, it was great. Thank you so much for jumping on and educating us a little bit more about Onset. I'm Ashley Dalzell with Benco, and I surely will be running around with my pen, so I'll be able to demo to doctors as well. And I hope you have a great day, and thanks for tuning in.